Today's news for you, a new option to treat, even immediately stop migraine pain in a procedure that uses a catheter through your nasal cavity. Dr. Ezra is an anesthesiologist at Palmetto Pain Management. And Doctor, we're going to look at some video of this, but there are a group of nerves behind the nose, the medical word being sphenopalatine ganglion. And you're going in to the nose, through the nose. Explain how the procedure works to try to deaden those to the pain.
Absolutely. I just want to point out that it's actually an old procedure, one that we've done for 25, 30 years. This is a new technique. So I can show you because I brought a little catheter here. We just numb the nose up and with some lidocaine jelly. And then this is kind of long, but we only put it in about that far, just to the nasal bone. We do it under fluoro, which is a live x-ray, so we can see exactly where we're going. We get it right to the spot, and we then will deploy this, and it makes a little angle. We put a drop of contrast, which is x-ray dye, so you can confirm where it goes to this nerve bundle. Then we put the lidocaine in. And
it's just about 4% lidocaine that goes in, and sometimes you mentioned sometimes steroid. How much does this cost, and how long does it last? Because it seems a bit invasive.
It's covered by all insurances, like I said, because it's an old procedure. It's nothing new. And it's really not invasive. This is a flexible catheter. We don't use a needle, and it's not painful at all.
Why not do the procedure, though, endoscopically through the forehead, subcutaneously? Because I know some doctors will do it that way with the lidocaine and get great results. Why not do it that way?
This is so much simpler. This is essentially non-invasive. I mean, we don't think of the nose as being invasive. You're not puncturing any membranes. You're not using a needle. You're just going up to a normal passage, which is right just as you enter the nose, and you're basically dripping some medication backwards. We have the patient's head back so that the patient has the medication go back that way. So it's as I call it, elegantly simple.
And you say this works for more than headaches. It gets people's attention because of dealing with headaches and migraines and having such trouble trying to get rid of those. But what other conditions could be covered in this?
Absolutely. Because we're numbing an area that's like, think of it as a very complicated 5-point intersection where there's many, many nerves coming in. Cervical nerves, occipital nerves, trigeminal nerves, so it can treat trigeminal neuralgia, it can treat dental pain, it can treat cluster headaches, it can treat any type of chronic head pain or neck pain or facial pain or oral pain that has to do with those nerves.
Not successful for everybody, though, right? Do
No.
some people just not respond to it?
Absolutely. We have a range of responses from excellent to months and months to not working at all, but you really have nothing to lose. It's such a simple procedure. It's safe, it's simple, it doesn't hurt, and the worst that'll happen is it doesn't work.
Well, what a miracle procedure it could be for some people. For those whom it would work for, we would be excited to know that they could get some relief.
Absolutely. In fact, I was going to send someone else in my place this morning, a woman I hadn't seen for 9 months, and she said she hasn't had a headache for 9 months, but I decided to come here myself.
Thank you. And if you want to see this interview again, it will be on Twitter, on my account, and also on my Facebook page. But I want to hear from you now. Send me a tweet to Dawndy, WISTV. Let me know how you deal with headache and migraine pain, and I'll share some of your answers at the end of the show.